Well, we've got a couple of interesting, if not concerning, stories that are developing south of the border and raising no doubt that concern around the general public is important.
So that's where we like to turn to Dr. Isaac Bogoch, of course, infectious diseases specialist at Toronto General Hospital. It's interesting. This is a COVID-free conversation, even though I did drop the C word just now, Dr. Bogoch. But let's get into it with this. And it's kind of got echoes of this HBO Last of Us thing here, but this drug-resistant, potentially deadly fungus, it's been spreading rapidly throughout U.S. healthcare facilities, really affecting very vulnerable people. So what is Candida auris and why is it causing so much concern?
Yeah, thanks for bringing that up. This is certainly an issue within the healthcare system. This is called Candida auris. We're watching it very closely. It's been known to exist for, well, about a decade or so. This is a fungal infection. It primarily impacts the most vulnerable individuals in healthcare settings. In 2019, for example, there were 476 infections in the United States, but it went up pretty significantly over the last few years. There were over 1,400 cases reported in 2021. So that's clearly concerning. And as you point out, the real issue with this fungal infection is that there are very few drugs to treat it. It's pretty drug resistant to all the existing antifungals. There are some antifungals that work, but there's some concern that they might not work for much longer in many cases. And it can be deadly. And the problem is, of course, it impacts the most vulnerable people who are in healthcare settings. But is this something that's spreading widely among the general community? It is absolutely not. This is really almost not exclusively, but primarily in healthcare settings. And we do have it in Canada. There have been just around 50 reported cases since 2012. So it is here as well, something that your healthcare settings will be watching closely and really taking very strong infection prevention and control measures to curb the spread of this.
And another thing we're trying to curb the spread of, a giant blob of seaweed called sargassum might be heading towards some popular spring and summer travel destinations. You got to know, what is it? Is it safe?
Yeah, I mean, it's kind of gross to think about, but this is actually a result of warming temperatures. This is a brown seaweed, sargassum. And again, it's just seaweed. Probably everybody's seen this before if you've traveled to anywhere around Florida-related areas. But there's a lot of it this year. I think two things to be weary of or mindful of. One is if it touches your skin, the seaweed itself doesn't really irritate the skin, but of course there's some other organisms that can be on the seaweed that can cause a rash or irritation of the skin. The other thing too is when it lands on the beach, especially in large quantities, it can rot and it produces a gas, hydrogen sulfide, that it actually smells like rotten eggs, but it can be a bit irritating to the eyes or nose. It shouldn't be an issue if you're outside. It's just some people who have underlying breathing issues like asthma. Sometimes people have some exacerbation of an underlying breathing issue, but it certainly can smell pretty bad as well.
Yeah, gross, I think, is the word that you use. So you're the doctor, you're the expert, so I'm going to use that word as well, just as looking at all that viz and then thinking about the smell. Yeah, I understand it's going to be arriving sort of in the southeastern United States around July, so book your travel accordingly. In the meantime, Dr. Bogoch, I assume you're also keeping your eye on the sort of reports of avian flu in and around, Peel region, Halton region. What's the big message here?
Yeah, it's important to recognize that, this is a big year for avian influenza. This is H5N1. We've heard about it all over the planet. It's spread by migratory birds. Of course, Canada's not immune. We've seen some cases of this sadly in dead wild birds here in Canada. Key message, obviously, it's not transmitted effectively between birds to humans, but it still can be. So stating the obvious, if you see a sick or dying bird, don't pick it up. Don't touch it. Avoid it. H5N1 can be very, very severe in birds, but also in human populations. The other thing that people might not recognize or might not think about right off the bat is watch your pets. We know that pets or scavenging animals who are eating or picking up or in contact with the dead birds can also get this infection that can be deadly as well. So again, pets, humans, stay away from dead or dying birds. It's here in the GTA. It's just something to be mindful of and avoid.
All right, a lot of stuff to keep in mind. Avoid dead birds, keep your pets safe, keep yourself safe, and plan travel accordingly. Dr. Isaac Bogoch, thank you so much for joining us this morning.